Welcome back. My name is Dr. Ivy Branin, and if you're joining me for the first time, I am a naturopathic doctor specializing in women's health and hormones, as well as digestion and skin, based here in New York City, but seeing patients all over the country and all over the world since we are now completely virtual. Today, I want to talk about something that you might have heard of, but you might not exactly know what it is. I'm going to talk about yeast overgrowth. If you like this video, don't forget to like it. And also, if you like this video, don't keep it a secret, and also subscribe to my YouTube channel as we're updating with all other fascinating videos on women's health and hormones and digestion. So yeast overgrowth. First of all, yeast is actually part of our natural normal flora. It's found naturally occurring on our skin, our digestive tract, and our mouth in the forms of Candida albicans and Candida glabrata. Now, normally, it's only found in small amounts. So when we're talking about overgrowth, what we literally mean is that there is an overabundance of this flora, basically this fungal flora. And overgrowth of Candida comes in different names. So sometimes you might just hear it as Candida, referring to the organism, typically usually Candida albicans, but also you might have heard of the term candidiasis, which is the medical term, sort of basically what a medical physician would use with the diagnosis. Another term for Candida overgrowth is SIFO, which is small intestinal fungal overgrowth, and that's specific to the small intestine, very similar to another condition called SIBO, small intestinal bacterial overgrowth. And if you want to learn more about SIBO, you can watch my video on SIBO, small intestinal bacterial overgrowth. So first of all, just like in general with yeast overgrowth, so it can be definitely in the digestion, it also can be on the skin, and also the vaginal tract, and also even in the mouth. So why do we possibly get yeast overgrowth, specifically if it is considered natural flora? So first would be small intestinal dysmotility. And if you watch my SIBO video, you'll learn a little bit more about what that is. But basically what that means is that under typical circumstances, our body sends, or basically I don't want to get too much into all the technical parts, but basically that typically our small intestine should be engaging in peristalsis, allowing fecal matter to pass. But if there is a dysregulation in that, that can cause yeast to overgrowth, because basically we need robust peristalsis to flush out bacteria and yeast. The other big cause of yeast overgrowth is certain medications. So proton pump inhibitors, which are commonly prescribed for acid reflux, because that they decrease stomach acid, they allow opportunistic bacteria and fungus to proliferate. So that's one of the negative side effects, amongst many others, of proton pump inhibitors, aka PPIs. Antibiotics, which I think most specifically some of my female viewers might know that after a course of antibiotics, you might end up with a yeast infection. And basically when you kill off all the bacteria, specifically depending on the type of antibiotic used, you're killing off some of your beneficial bacteria that prevent the proliferation of yeast and actually keeps it under control. Then another medication, which probably some of my viewers might be familiar with, is hormonal birth control. And the big part is by changing the amount of hormones that we have in our body does affect our beneficial flora, which again, beneficial flora help to block out flora that we don't want. Then diet is also a big cause of yeast overgrowth. So diets rich in high sugar, high refined carbohydrates, and unfortunately, alcohol. So basically, all these foods, one, feed yeast, or they have an effect on blood sugar regulation and insulin. And that's why another cause of yeast overgrowth is actually diabetes, specifically uncontrolled diabetes, when you're having chronically elevated blood sugar levels. Weakened immune system, which might be fairly obvious that if your immune system isn't robust, it's not going to be able to fight off infections, including yeast overgrowth, and allowing things to get go out of control. And then lastly, stress. So stress has like many different reasons. Well, one, stress affects our immune system. Stress also affects inflammation. And if you want to learn more about, and also stress affects digestion, I have actually quite a few videos on my YouTube channel all about stress and its different impacts in different parts of our body. So how would you know if you have yeast overgrowth? So there's many different symptoms. So first, some of your classic digestion symptoms, things that you might associate with IBS, irritable bowel syndrome, constipation, diarrhea, bloating, belching, reflux, nausea, gas. These are all GI symptoms that could be from other conditions, but they are very much linked with yeast overgrowth. Another symptom would be fatigue. And a big part of why someone might experience fatigue due to yeast overgrowth is that when you have an overgrowth of yeast, it does actually affect certain nutrient levels, things like vitamin B6, essential fatty acids, and magnesium. And so when these levels aren't optimal, you're going to feel more fatigued. Also, when I talk about one of the next symptoms, there's a lot of negative byproducts of yeast. And that's why one of the classic symptoms, and what kind of, whenever I have a patient who might have a myriad of digestion symptoms, if they have this next symptom, I'm definitely thinking yeast overgrowth. And that is brain fog. And what is brain fog? Difficulty remembering things, feeling like a haze. And a lot of that actually has to do, one, back to like the nutritional deficiencies, but also some of the negative byproducts that yeast, when they're eating, they produce, which can result in brain fog. The other would definitely be recurring vaginal infections, urinary tract infections, sinus infections, skin infections, including acne. So whenever I have patients, I work a lot with acne patients, and specifically one of the classic yeast acne pictures is acne on the forehead. I'm definitely usually thinking yeast is contributing. And then the last symptom would be joint pain. So those are some of the symptoms one might have with yeast overgrowth. Okay, so if you have yeast overgrowth, what do we do? So first, what we want to do is that we want to basically eliminate the yeast overgrowth using, if you're working with someone like me, a naturopathic doctor, I'm going to be using natural antifungals. There are also a lot of prescription antifungals that if you're working with either a naturopathic doctor that does prescribe or a medical doctor, definitely, so anti-yeast, antifungal, either natural or prescription. Supporting the immune system to fight off the infection is really important. Eliminating both foods that increase or feed yeast, but also yeast-containing foods. And more around with the yeast-containing foods, often we're seeing sort of a cross-reactivity, specifically in patients that have had persistent yeast and that they have a low tolerance for yeast products, even if they themselves aren't necessarily going to cause yeast. So we typically would eliminate yeast-containing foods as well. And then once we've eliminated these, then it's really important to repopulate with beneficial bacteria, plus also making sure that the patient is has a diet that will feed the beneficial bacteria. So speaking about diet, so what exactly would be an anti-candida diet? And it can be really confusing, and there's so many websites now and so many different dietary approaches. So when I'm working with a patient, baseline candida diet is eliminating refined sugar, carbohydrates, dairy. So the reason dairy, because of specifically very, very unfermented dairy, because of the high lactose content. So lactose is the milk sugar, and yeast like to eat that too. And alcohol. And again, alcohol, you might see, oh, it doesn't have, like, what's the difference between sugar alcohols and things. But the big alcohol itself has effect on blood glucose levels, stress hormone, cortisol. So it's really not a good idea to have. And then also some alcohols, things like beers and wines, do actually have sugar and contain some yeast. So very problematic. Don't want to have alcohol if you want to get rid of candida, specifically you want to get rid of it fast. With my patients, I can encourage a high non-starchy vegetable intake, so about like 4 to 6 cups daily. So that's things like lettuces, arugula, broccoli, cabbage, zucchini, spinach. I know that some of these foods I mentioned are high FODMAPs, and that's like also like another conversation. And if you are curious about what FODMAPs are, definitely watch my SIBO video, but definitely encouraging, again, high vegetable intake, smart carbohydrates. So I'm not necessarily saying that you can't have carbohydrates if you are on an anti-candida diet. I'm talking about smart complex carbs, things like sweet potatoes, plantains. I love yuca and cassava, quinoa, lentils, not a lot of grains, but quinoa and lentils, and some beans. I love winter squashes. And again, if we're thinking about specifically with patients who are having yeast overgrowth, particularly to the vaginal area, those specific types of carbohydrates really actually help to encourage healthy vaginal flora. So really, really important. Protein, so definitely encouraging a lot of protein, and then just some kind of we'll go into a little bit of the herbs and supplements, but I can talk about right now, lots and lots of garlic and coconut oil. And as I'll discuss further, coconut oil actually is a source of one of our key natural antifungals. So what are some of the supplements that I often recommend for patients with yeast overgrowth? So again, we already talked, just definitely across the board, definitely want to make sure you're getting enough immune supportive nutrients, things like vitamin C, zinc, selenium, basically all your vitamin A, vitamin D. So we want to make sure definitely that you're getting enough of your immune supportive nutrients. On top of that, want to look at some of the natural antifungals. So as I mentioned before, coconut oil has a component that's very antifungal, and that is caprylic acid. So I find caprylic acid is very, very helpful, as is, again, I said garlic, and there's different forms of garlic. And again, if you're worrying about FODMAPs, most of the supplemental garlic forms that just contain allicin does not have an effect on FODMAPs. Oregon grape or berberine, coptis, Chinese skullcap, grapefruit seed extract, and then essential oils. So I love doing enteric-coated essential oils, specifically if it is specific to the GI tract. So things like thyme, oregano, lemon balm, sage. Now, definitely you have to be careful with essential oils. You want to be really careful with one quality, and also the form. So definitely want to do encapsulated. Don't want to go kind of crazy and just start drinking essential oils. And then the last part of the supplements is biofilm disruptors. And this is one of the reasons why I think sometimes certain yeast overgrowth protocols fail, is because they forgot to do the biofilm disruptors. And so biofilms, both bacteria and yeast, because they don't want to die, they want to proliferate, they produce biofilms that can prevent some of either antibacterial, antibiotics, antifungals to basically come in and kill them. So adding biofilm disruptors, things like a lot of basically enzymes, specifically serrapeptidase, along with alpha lipoic acid, really effective. So I never don't prescribe that. Also interesting with these types of enzymes, unlike when you're taking enzymes to digest food, you actually want to take them away from food. Otherwise, they're not going to be very effective. And then the last supplements, obviously, or I don't know if obviously, but probiotics. And I typically, when I'm working with a patient, give them very specific probiotics to their own individual case, and also what is the area that's most affected. So with my reoccurrent urinary tract and vaginal infection patients, definitely wanting to prescribe them a really effective probiotics that contain lactobacillus rhamnosus and reuteri, but then there's also other strains of bacteria that are more effective for other regions of the body. So hopefully you found that helpful. And again, if you liked this video, don't forget to like it, and please subscribe to my YouTube channel as I'm constantly updating with new exciting videos. And also, if there's anything that you've been wanting to learn more about, you can always also post that in the chat. We're always looking for new ideas, and we just really want to get you the best information possible. So again, everyone, my name is Dr. Ivy Branin, Naturopathic Doctor in New York City, and looking forward to seeing you next time. Take care.